Welcome to this explainer. Today, we're tackling a condition that definitely affects a lot of guys, but honestly, it's talked about by far too few. We're talking about Peyronie's disease. Listen, if you, or maybe someone you know, has suddenly noticed a physical change down there, you are probably feeling a ton of anxiety and uncertainty right now. And that is completely understandable. But take a breath, because you're in exactly the right place. We're going to clear up the exact medical timeline today, decode the different stages of this condition, and give you the actual facts you need to understand the road ahead.
When you first spot a new penile curvature, maybe a lump, or you start feeling pain, there is almost always one absolute immediate question that pops into your head, right? How long is this going to last? Like, is this going away on its own, or is this permanent? It's a completely natural reaction. Okay, let's dive into this, because the answer isn't just a simple yes or no. It really depends heavily on the specific stages the disease actually progresses through. And honestly, understanding those stages is your single most powerful tool right now.
So, to satisfy your curiosity right off the bat, the high-level answer here is that the active, changing phase of this condition typically lasts anywhere from 6 to 18 months before it finally stabilizes. Yeah, 6 to 18 months. It definitely doesn't happen overnight, but there is a definitive timeline. Once that active window closes, the condition usually stops worsening, but, and this is a big but, that doesn't necessarily mean it just magically disappears. Let's break down exactly what that timeline means for you.
Here's our roadmap for today. We're going to cover 1. The big question. 2. The acute active phase. 3. Entering the chronic phase. 4. Will it resolve naturally? 5. Warning signs to watch. And 6. Non-surgical treatments.
All right, Section 1. The big question.
Before we can even talk about the timeline, we really have to define what's physically going on under the skin. Think of Peyronie's disease, at its core, as a kind of wound-healing glitch. What happens is that scar tissue, which doctors call plaque, forms just under the skin in a thick, elastic membrane known as the tunica albuginea. Now, this membrane is exactly what helps keep everything stiff during an erection. Medical experts actually believe this plaque builds up from micro-injuries, usually from vigorous activities. So when that scar tissue forms, it doesn't stretch like healthy tissue does. It acts like an anchor, pulling on the surrounding areas, which is what causes the curvature, narrowing, or shortening. Oh, and I want to be absolutely 100% clear here. This plaque is completely benign. No way is it cancerous, and it is definitely not a tumor.
If you're dealing with this, you might feel like you're the only guy in the world going through it, but check out this stat. 1 in 10. While official medical diagnoses sit at about 1 in 100 adult men in the US, newer research actually indicates that up to 1 in 10 men experience this. 1 in 10. So why the massive gap? Well, it's because so many men just suffer in silence out of embarrassment. We really need to destigmatize this right now. It's a surprisingly common medical condition, you are absolutely not alone, and there is zero reason to feel ashamed about getting help.
Okay, let's move to and see how this builds as we head into Section 2, the acute active phase.
This timeline right here visually maps out that acute window we talked about. Day 0 is the onset, and honestly, this is often a micro-injury you might not even remember happening. From that point, you enter a period of active physical changes. Now, for some guys, this phase might be on the shorter side, wrapping up those active changes right around the 6-month mark. But for others, it can stretch all the way out to 18 months. It's a really dynamic window. The condition hasn't locked in or stabilized yet, meaning what you see and what you feel can genuinely shift from month to month.
So, what's actually happening to your body during this acute time frame? Well, active inflammation is firing up under the skin as your body scrambles to heal itself. This is exactly when that scar tissue is actively forming and growing. And because that plaque is tugging at the elastic membrane, the actual curvature might change or get progressively worse. Plus, and this is a big one, because of all this active inflammation and shifting tissue, erections during this phase are often genuinely painful. It's literally your body in the midst of an active reaction.
But eventually, that active reaction burns itself out, which brings us to Section 3, entering the chronic phase.
And this brilliantly illustrates what happens when that 12 to 18-month window closes. There is a really stark contrast between these two phases. The acute phase, it's chaotic. You've got the painful erections, the active inflammation, the changing curve. But then you hit the chronic phase. The inflammation finally subsides, meaning the pain usually dials way down or disappears completely. The curvature stabilizes, so it generally won't get any worse. Looking at this side-by-side comparison is actually a fantastic way to try and self-identify which stage you might be in right now. Now, there is a catch to the chronic phase. While it is a huge relief that the pain goes away, the scar tissue itself actually hardens. At this point, the plaque is done actively growing, sure, but it is also not going anywhere. In this chronic phase, spontaneous improvement is highly uncommon. Basically, without some sort of medical intervention, the curvature and the plaque that you're left with at the end of the acute phase, that's likely going to become permanent.
Which naturally leads us to Section 4. Will it resolve naturally? This is easily one of the biggest myths out there.
I want to give you the hard medical truth right here. Based on urological data, only about 13% of cases naturally resolve on their own without any treatment whatsoever. Just 13. Now, for a very lucky few with incredibly mild cases, yeah, minor damage might improve over time. But for the vast majority of guys, just waiting around is definitely not a cure.
Now, what's really interesting about this slide is the overwhelming reality of that 87%. If you do nothing, literally just wait and hope, there is an 87% chance that your condition will simply stabilize exactly as it is, or in some cases gradually get worse before it finally locks in. It is a really stark reminder that while the pain might pack its bags and leave, the physical change to the tissue rarely leaves on its own.
Because simply waiting is rarely the answer, let's jump into Section 5, Warning Signs to Watch.
These are your absolute red flags. If you're experiencing any of these, you really need to book an appointment with a urologist. Watch out for pain that persists for months on end. Be hyper-aware if that curvature continues to increase noticeably, and most importantly, if the curvature starts making intercourse difficult, painful, or completely impossible, you need to get an evaluation. Also, the development of erectile dysfunction, or ED, is a major warning sign. Look, this condition doesn't just mess with physical function. The sources note that over 75% of men with this disease experience severe stress or depression. Your mental health matters just as much as your physical health here, guys.
I really want you to internalize this quote drawn directly from our medical sources. Ignoring the problem does not mean it will go away. The longer the condition persists untreated, the greater the likelihood it becomes totally permanent and way harder to correct. Early intervention, especially if you can catch it during that acute active phase, just opens the door to far better outcomes and much more conservative treatment options.
Speaking of options, let's transition to our final section, Section 6, Non-Surgical Treatment Options.
So if you catch this in time, surgery is rarely the first step. Here's a breakdown of the primary non-invasive therapies you might look at. First up, we've got injections. The FDA has actually approved an enzymatic treatment called Xiaflex, which is specifically for men with curves greater than 30 degrees. They basically inject this enzyme directly into the plaque to actively break down that collagen scar tissue. Pretty amazing, right? Next, we have traction therapy, which uses a mechanical device to gently stretch the tissue over time. Lastly, there are oral medications. Now, it's really important to note that the clinical evidence for pills is actually quite limited when it comes to fixing the curve itself, but doctors do sometimes use them for basic symptom and pain management early on.
Let's look a bit closer at penile traction therapy, because it's a really fascinating, non-invasive approach. Step 1 simply involves wearing a specialized external device. Step 2 applies a very gentle, controlled stretch to the tissue. And Step 3 results in the gradual breakdown of that restrictive scar tissue, basically encouraging your own body to adapt and correct the curve over a period of months. So the crucial point is that this therapy uses a simple, natural, and historically proven mechanism, tissue adaptation through controlled stretching, to help restore lost length and improve the curvature, all without any needles or scalpels.
Well, we have covered a whole lot of ground today, right? From the chaos of the active phase to the hardened reality of the chronic phase and the therapies that can actually help you intervene. You are now equipped with the medical facts, the true timelines, and your real options. So I'll leave you with this final thought. Now that you know exactly how this disease progresses, what steps are you going to take control of your health today? Please, don't suffer in silence, and definitely don't gamble on a tiny 13% chance of it magically fixing itself. Reach out to a specialist, advocate for yourself, and get your quality of life back. Thanks so much for joining me for this explainer, and keep learning.